y su alma viaja así, cantando como un pajarillo, curruqui, cantando es su destino, y me despierta cada mañana con su canción de amor. No hay nadie como tú, es más. Eres culpable por dándome tentación, y en tus ojos me desvelo, y tus labios me buscan en la oscuridad, como oraciones de la noche. Le pido a Dios que me dé felicidad. Eres como el viento que me lleva, volando por ahí, volando por donde quiera, como fantasma, fantasma, como fantasma, fantasma que a veces aparece.
Is joining. We're at 17 participants right now. We'll give it just a couple more minutes for folks to join us. Thank you for joining. We'll get started in just a couple minutes.
Eres culpable por dándome tentación, en tus ojos me desvelo y tus labios me buscan en la oscuridad, y como oraciones de la noche le pido a Dios que me dé felicidad, mucha paz para mi madre y mi padre, hermanos. Yo sí he estado muy bien y mal, ten piedad, ten piedad, ten piedad, ten piedad. De hecho somos de la misma sangre. No hay nadie como tú. No hay nadie.
So what are students there telling you? How is this going to help them?
Andrew, you mentioned Texas Southern is an historically Black college. I know Black voters,
Thanks everyone for joining. I think we are hovering around 18 participants right now. So as folks start coming in, we can get started. I wrote in the chat to please feel free to introduce yourself and feel free to put your name, your pronouns if you're comfortable, where you are located, and what your site is. That would be great if folks could write that into the chat. And we can go ahead and get started. Thanks so much for joining today, our last monthly all partner call before we move into the learning collaborative period of the Innovating Contraceptive Care in Community Health Centers project. Very excited to see everyone today. Next slide, please. A brief look over the agenda today. We're going to do a quick introduction, reorient ourselves in the project timeline, and then get really into the meat and potatoes of our presentation today, which is engaging in a quality improvement learning collaborative. So we'll go through some specifics on how to engage in a quality improvement learning collaborative, including defining what that means. And then we'll go into an introduction on our webpage, the ICC and CHCs webpage. We'll follow up with some next steps and reminders and give you all a sense of what's to come in the next month. Next slide, please. Great. As usual, we are joined by our UCSF colleagues here, Dr. Christine Dellendorf. Danielle Hessler is actually out on vacation this week, but will be joining for our first session in the learning community. Myself, Lindsay Gibson, I use they, them, or she, her pronouns, either is fine. I'm the project manager for this project. We're also joined by Becky Kriz, Aaron Wingo, and Sonia Goch Avila, who was playing that beautiful music for us at the top. Thank you, Sonia. And we're also joined by our colleagues at Bar Harbor, Phil Hastings, Bei Dong, and Ella Puga. Thanks so much for joining today, guys. Next slide, please. And welcome to our partners. I've included everyone on the slide. It warms my heart to see everyone all together on this slide. And I see you all writing into the chat. Thank you so much. Please continue to introduce yourself. Again, name, pronouns if you're comfortable, your role, and where you're located and what site you're at. Next slide, please. Great, so to reorient us in our project timeline, it's been a long time coming. So currently we're in our completing our baseline data collection phase to finish up in the end of August. And then if you could just click for me, Sonia. We are moving into the quality improvement period, hooray! So we're gonna begin in September where we'll have our first learning session in the second week of September. Thank you all for your perseverance during this. This has been a long baseline data collection period, and we're so grateful for all of the effort that you've been putting in. It really is phenomenal. Next slide, please. So now to get into sort of the nuts and bolts of engaging in a quality improvement learning collaborative. It's also called a QILC, just to shorten it, so folks know when I say QILC, it stands for Quality Improvement Learning Collaborative. Next slide, please. So just a quick check-in with folks. I know some folks have participated in a formal quality improvement process. Some folks have not participated in a formal quality improvement process. So just a quick check-in with folks. Maybe we can answer in the chat, or if folks want to come off mute, we could engage about this for a couple minutes. Have you or has your site ever participated in a learning collaborative before? If you have, what was your experience like? What did you like about it? What didn't you like about it? Where could we improve? If no, what questions do you have? Do you have any apprehensions about a QILC? And also, has your site engaged in quality improvement before, either in a formal capacity or an informal capacity? Are there any lessons that you'd want to share with us? Or if you haven't engaged in QI, what questions do you have? Is there anything that we can do to offer some support and answer any questions right now? So feel free to write into the chat, or folks, let me see if anyone wants to come off mute. I'm not seeing anyone come off mute right now. Got a quiet group this morning. Awesome, thanks, Brian. Brian said we have not had a culture of QI, so they're excited to begin to build that. Very cool. We're very happy to help you with that process. Yep, totally. Perception of taking time away from patient care is a concern, for sure. We've designed this QILC to be as light touch as possible, and hopefully we can, if folks are having concerns about taking time, we can totally talk about balancing and how we can support to make this as light a touch as possible. Thanks, Marianne. I've not participated in a similar project, but excited to learn. Great, really happy to hear that. And again, we'll be going through the structure of QILC, how projects are created, etc. So we have a lot of support baked into this project. Ocean has worked in some learning collaboratives, very cool, reproductive and cardiovascular. Great. Okay, sure. Do ongoing QI, not collaboratives, sure. So we'll get into how we define the learning collaborative in a couple slides, man. You're a mind reader. Time, bandwidth, energy, staffing, totally. A lot of bandwidth concerns. Awesome. Well, thanks everyone for sharing. We'll go into, again, defining some of these concepts. Maybe we'll leave today's presentation with a little bit more of a fleshed out understanding of how this QILC will be operating. Great, and feel free to keep typing in the chat. You can keep the conversation going. Next slide, please. Great. So what is a QILC? What is it that we're doing? So a QILC brings together groups who share a similar mission in a particular focus area in healthcare. So you can have QILCs in really any sector of healthcare or any focus area. For our group and the purpose of our QILC, we are focusing on patient-centered contraceptive services in CHCs. And so all of our content and all of our tools are driven by the quality improvement concepts that we've outlined in our project's website, which we'll be getting into in depth momentarily. Next slide, please. QILCs will utilize research and knowledge from experts in the field. We'll bring in experts into our learning sessions. We'll also have a lot of tools and resources provided for folks that are structured and created by experts in the field. So there's a big emphasis on learning collaboratively with folks, peer learning from each other, figuring out what works, what doesn't work, a spirit of camaraderie and testing with one another. Again, driven by research that is well known in the field and emerging in the field. We will provide tools and resources, including but not limited to the key strategies for addressing quality improvement at your sites. We will also provide one-on-one technical assistance. So if you're struggling with a problem or if you want to talk through data collection or any type of issue that you're experiencing, we're happy to have one-on-one technical assistance, either with us at UCSF or in partnership with our data experts at Far Harbor. So rest assured that we will be able to provide that for you. And we'll also provide support in measure collection, as well as data analysis for those measures that we've been collecting. So the PCCC and then the sync-based ECQMs. Next slide, please. Great. So I pulled this model from our website. So for folks who have engaged in some QI before, this may look familiar. Again, this resource is available on our website. So moving through our model for improvement, starting at the top, you would want to establish aims. So in the previous slide, our aim is to improve the person-centeredness in contraceptive care. You can also have 2 aims, 3 aims, 4 aims. Our main aim, obviously, is to improve the patient-centeredness in contraceptive care. Your site's aims can also be more specific or like more close to home, such as we will reduce wait times by 30%, or we aim to fully train our current and new staff in how racism affects healthcare by May 2023, by the end of the collaborative. So you can have multiple aims, you can get specific with aims, however you want to be specific enough so that you can track your progress using measures, which I'll talk about in a second. But you want to be sure that it's general enough that you can establish different solutions to the same problem. So that there are multiple ways to address your area of improvement. You utilize measures. So how will we know that a change is an improvement? We utilize measures. So as part of this project, like I mentioned before, we'll have the support with the PCCC collection, as well as the sync-based ECQM collection. Those are 2 measures that we'll utilize in the project. You can also feel free to add other process metrics as we go. Balancing measures, as they're often called, are often important to ensure there's no like bubble up in other areas of care while addressing your proposed quality improvement area. And then moving on to the last one, changes. So what, oops, sorry, Sonia. What changes can we make that will result in an improvement? This is really moving you through, like this is where your site can choose from the strategies that we've presented to make those changes in person-centered care. We'll talk a little bit about PDSA cycles in a minute, so I won't go through that. But in terms of processes in moving through quality improvement, starting from the top, you'll want to form your teams, again, setting those aims, establishing what measures you want to use in order to measure the changes that you're making. Select changes, that's strategies that I was talking about previously. You'll want to test those strategies in a real world scenario, implement your changes that you learned from making those tests, and then spread those changes throughout your CHC. Next slide, please. So as part of our QILC, we have 4 main areas for targeting change, which can include leadership, clinical operations, staff attitudes, knowledge, and beliefs, and financial sector, so financing contraception. Our website includes many targeted strategies that sort of fall within these 4 top level categories, which would help jumpstart your site's QI efforts. Next slide, please. So getting into what a PDSA is and an action period. So again, to test those changes that we'll be implementing, we could do what's called a PDSA cycle. It's a plan, do, study, act cycle. PDSA cycle should be simple and efficient with the goal of gathering just enough data to determine whether your specific change or strategy will lead to a measurable improvement. So rather than doing like a whole long project on testing, these are short little cycles, and it runs through like this. So you would plan out a small test. You would define the who, what, where, and when for your test. So who will be doing this strategy? What exact strategy will they be doing? Where will it be implemented? And when will it be done? You want to form your hypothesis. So for example, to draw from a previous example on patient wait times. So who will be responsible for reducing these wait times? What is it that they'll be doing in order to reduce the wait times? In what place, like where, in what place will you be testing this? And how long, the parameters of how long you'll be doing this test for and when it will be done. Forming your hypothesis, you can say, we think streamlining our check-in will reduce wait times, and then carry out your test, which is the next step in the do category. So carry out your test. Collect data for what you're testing, make sure that you are observing and observing the process, and document what happens during that cycle. Once all that's completed, you're going to study what happened. So you did your test, you ran your test, what happened during it? Did your test confirm your hypothesis? Did it deny your hypothesis? How can you make a plan to do it differently next time? You want to summarize and collate your results, put everything together, and make sure that, again, you're documenting, and then act. So what now? If your test worked, do you want to implement this in your site in a larger reaching way? If it didn't work, are there tweaks that you can make? Are there any changes that you would make? Is there anything that happened along the process that you would want to change, etc.? So PDSA cycles are really helpful. They are encouraged for use during this project, but they are not required. So you don't have to report back to us any data that you gather from the cycles, but we will make space in learning sessions and an individual TA for you to share any lessons that you learned, successes, misses, strategies. We will be here for you and support you in going through these cycles. We've put our PDSA cycles as implemented as part of our action periods, which I will show the learning community schedule in just 1 second. Can you go through the next slide, please, Sonia? So again, talking about action periods, here is a brief overview of what our learning collaborative period will look like. So hopefully folks have gotten our invitations for our first couple of learning sessions. The first will take place on September 16th. And this will really be a baseline understanding of using performance measures as a tool in patient-centered contraceptive access. Going into our second learning session in health equity and racial justice, and which will bring us into our first action period. So once we really get these core concepts solidified, we'll move into an action period where sites will be able to, again, go through those strategies and perhaps test them out in a small setting for a short period of time. We have a pretty open window from, again, the beginning of November to the end of December, but this will give you time to, again, figure out what strategies you might want to use and collect any data related to your PDSA cycles. We'll move into the next learning session in November on screening patients for contraceptive care needs, and then in December, moving into clinician training and person-centered contraceptive services. So these are really our core learning sessions. As you can see, for learning session 5 through 9, we want this to be an iterative process that is helpful to you all. So if there are any topics that you would be interested in learning about that could further your growth, that could further your QI, we will begin to start soliciting any ideas that folks have after learning session 2. So that's that October learning session. And we'll have folks vote on topics that they would like to see for the remainder of the sessions. We did brainstorm as a team just some ideas that other folks in other QILCs that we've worked on before have been interested in. So improving infrastructure to promote access to methods, integrating contraceptive services into primary care, team-based approaches to improve contraceptive care, any sort of like financial perspectives, and then telehealth and same-day contraceptive access. Again, these are ideas that we've generated, but we want to hear from you all on what would be helpful and what you all would like to know more about and what we can provide support on. Next slide, please. So the timeline, again, viewed in a different way. So we can see where the action periods are beginning after learning session 2, 4, and 6. Again, these are multi-month periods, but these are just indications of when they begin. And then there will also be resources provided throughout. So like I mentioned before, we'll have that monthly technical assistance that's highly encouraged, but optional. Again, and month to month, some months you might want one-to-one TA, some months you might not want structured TA. So we can definitely work around schedules and bandwidths. We'll also provide peer learning through our learning sessions with your fellow CHCs. We'll provide support around data collection and analysis for the measures throughout this collaborative, funding for any initiatives that you have through the funding mechanisms that we've set up with you all, and then quality improvement tools and resources, again, housed on our website. Next slide, please. I'm going to put a pause here. I know I've said a lot in the last 15, 20 minutes. Checking in quickly, I'm looking over to the chat. I don't see any questions. Any questions that folks have before I give some information on our brand new website? Feel free to come off mute or write in the chat. Let's see, one right now. Well, if anyone does have questions, please feel free to drop it in the chat and I can address as we go along. So I'm very excited to show you our ICC and CHCs webpage. This has definitely been a labor of love, and we are excited to debut it to you all today. Next slide, please. So a little bit about the website. The website is a resource-based webpage. It hosts a quality improvement clinic assessment tool. So these are some questions designed to help your site figure out what would be a good area for quality improvement. It also contains a blueprint for action tool, which helps you prioritize areas for change and again, select those strategies for implementing change customized to what it is that your CHC will need. Some key things that you'll find, we'll have some QI background information. So like where I had pulled those models from before, we'll have some resources and some tools related to QI, again, all housed on the website. We'll also have learning session resources. So from any of our 9 learning sessions, we'll have recordings, we'll house tools or research mentioned on those calls, as well as agendas. Next slide, please. So how do we move through getting onto the website? So I've attached a screenshot here that will be what comes up for everyone who is joining our page. So we structured it such that team leaders who, as I'm scanning the participants list, we have a few on the call. Team leaders will be adding in team members from their sites to their groups on the webpage. This is the email that folks will get once we on the UCSF side will add team leaders to the webpage. So, and then once team leaders are adding their teammates on, everyone will get this invitation. So please, if you are not seeing it when we add you, look through your spam or look through I use Gmail, I'm a Gmail user, so sometimes things get flagged as not important, but just note that it will come from Innovating Contraceptive Care in CHCs. So as you can see, you're going to follow the link. Next slide, please. Which will bring you to the create a new account page. So this is a screenshot from our website. You're going to utilize the email address that that the message was sent to and create a username and password for yourself, similar to creating, I'm sure folks are very familiar with creating accounts for themselves in this day and age. And please feel free to add in your first and last name as well as your position in your organization. Next, please. After you create your account, you will be brought to this screen. You could tell I did a test run for myself on here. So it'll say registration successful. You're now logged in. You'll have a pending group invitation. So again, leaders, you will be adding your team members to your group. And I will show you a slide on that in a second. So for team members, you will have to, again, pending group invitation, visit your profile to see them. And next slide, please, Sonia. You'll click right there to visit your profile and you will see the invitation to your group. So here I am UCSF test. And then click one more time, Sonia. You're going to click accept here. This will bring you into your group. Next, please. You're going to get to the next, a little redundant, you're going to get to the next page where it will say accept invitation, join group. Obviously, you're going to click the thing there. And you've accepted the invitation. Great. Now you're in your group. You can see you are logged in as UCSF test. That's the name of our CHC test group. And you are now part of your team. So this, next slide, please. Hooray. Okay. Next slide, please. So team leaders, for adding your members, you're under your dashboard tab. You're going to scroll down. I'm going to show you through this in a second, but you're going to add your members through here. This is how you're going to get all of your team members within your group on the web page. And again, adding their emails at the bottom there. Next slide, please. Great. So once you are having an account, you've created your account, you're going to log in at the top right here. Up at the top right-hand side. Oh, can you just go back one more time? At the top right-hand side, you're going to go to account and click login. Next, please. And this will bring you to the login page. So again, once you've created your account, you're going to use your username and your password and log in through here. Next slide, please. And once you log in, this is what your page will look like. You will have a whole, oh, thanks, Becky, sorry. More than one person can be designated as a leader if you want them, if you want to invite folks on your team, right? So you can have more than one team leader for your group within the website. This may be helpful for team leaders who are needing support from other teammates as well. Thanks for that note, Becky. Again, so when you log in, this will be your first view of the page. On the left-hand side, you can see, I'll just run through these really quickly, the team dashboard, background information, which is where all of our QI resources are housed, performance measures, which will give you some more information on the PCCC and ECQM, your assessment, which we'll walk through in just a second, the blueprint for action, all those strategies and evidence-based interventions I was talking about previously, excuse me, the QI process page, as well as the learning community page, which we will walk through. Next slide, please. Great, so getting to your measure dashboard, I'm sure folks are anxious to view their PCCC and ECQM scores. So next slide, please. You're going to go right up here to team dashboard. You can see on the top left-hand side. Next slide, please. And this is what you will see. So we've got some dummy variables in here for the moment, but here is what your performance measure score readouts will look like. We've got our, if you can just scroll through, Sonia, really quick. We've got our ECQM scores for most mod and access to LARC. And then we also have our PCCC scores down here at the bottom. We'll also have an average score, so you can see how your score compares to other, compares to other scores. But again, when you're looking for any of your PCCC or ECQM scores, your dashboard is going to be the first place that you want to go. Next slide, please. Scrolling down the dashboard, you also have the clinic assessment progress report. So as I mentioned previously, we have a clinic assessment that you all can take that will help orient you in sort of what the best place for QI effort will be. We have a little progress report that will let you know how far in those 4 bucket areas of questions that you've gotten through for the clinic assessment. This will make more sense after we talk about the clinic assessment piece. So maybe we can go on to the next slide. And again, just a reminder, this is also contained in your measure dashboard. This is important for team leaders. You can invite your members through this little invite members area at the bottom. It'll also show you under administration here. These are all the team members who are in your team. So if you are wondering if you added Sarah to the team yet, you can check out this team members table under administration and see who all is included. Next slide, please. Okay, so talking about the clinic assessments. Next slide, please. You'll go to the assessment here, the assessment tab on the left-hand side. Next slide, please. And which will bring you to your assessment. So again, we've organized these questions to be helpful in orienting and evaluating your site to find areas of quality improvement. So next slide, please, Sonia. We've got these questions that you will answer. One more slide, please, Sonia. And as well as a progress bar to let you know how far you've gotten through the assessment. These questions, again, are tailored to making sure that you can identify areas for improvement. We have specific strategies tied to each of these questions, which I'll show in just a moment. But just to read a couple, I know they're a little bit small, but just to read a couple as examples. Even during times with competing priorities, my CHC's executive leadership team communicates that patient-centered contraceptive care is a top priority. So you can, one more slide, please, Sonia. And then we'll have a way to analyze your clinic responses. Hold on 1 second. And then go one more slide. Thanks, Sonia. Okay. So once we've, I'm gonna go really, actually, I'm sorry, can you go one more slide back, Sonia? I apologize. One back. One more. Sorry, I thought there was an additional slide where I had expanded out the questions. However, it's only the blueprint for action, but I will just talk briefly about answering these questions. So once you've put together all of your responses, these are on a Likert scale of 1 to 5. Actually, can you go forward, Sonia? I appreciate you. I'm sorry for all the back and forth. I meant to put one slide in there that had an expansion. One more, please. And one more again. And perfect. So as you can see here, it's again a little small. We have between strongly disagree, strongly agree, and unanswered. So again, in the example, even during times of competing priorities, my CHC's executive leadership team communicates that patient-centered contraceptive care is a top priority. My answer was a 2 here. You can also see the average answer in your organization, and you can select answers along this Likert scale of options. This is true for all the questions in the assessment. Once you create your selection, you can again go over to the blueprint for action and see areas for improvement. So as you can see, there are certain areas of improvement tied to this specific question. So once you sort your questions in the blueprint for action by how your answers were reflected in the assessment, you can see, okay, I scored a 2 on this. I don't agree that my leadership thinks that this is like an important thing within our site. So there are some areas of improvement tied to this question. So for example, in leadership, drawing on principles of transformational leadership when strategizing how to lead quality transformation. We have some staff engagement ideas tied to this question, like investing energy and resources in communicating about this QI project, conducting leadership rounds to engage with staff about services tied to QI. So for every question that you're answering in your assessment, there are strategies that are tied to these questions and ways to see how other folks on your team are answering these to identify any areas for improvement within your site. Next slide, please. And again, you can compare with the average answers. And then I'll go through the blueprint for action really quickly because I'm aware that we are running out of time. But if you just scroll through one more time, so you can add these areas for improvement to your QI plan template and strategize on which are the most important areas that you would want to address. One more slide, please. Thanks, Sonia. Again, I'm going to go through this super quickly because this is something that we will again cover in the first session of our learning community. And again, we'll have these resources available anytime. So like I mentioned before in the example that, maybe leadership isn't as invested in person-centered care as we would want them to be. So we can add this strategy to our QI plan template and have some fill-in areas here where we can work together as a team. What outcomes would we want to see with this item of investing energy into getting folks oriented to quality improvement and the mission of this project? So what outcomes would we see? How will we get there? What kind of intervention would we take in order to address this? And we also have a little priority bubble on the top where we can say, this is our #1 priority. This is the most important piece that we want to address, and that will run our PDSA cycles on. You can also say, it's not our first priority, it's our second priority. For all the strategies that you select from your assessment, you'll be able to provide a priority on them and add some notes about how you want to actually achieve these areas of quality improvement. Next slide, please. Again, highlighting where we can put priority. We're going to skip over the strategies and evidence-based interventions. Once folks get signed up for their accounts and access to the website, I highly recommend going through and just scrolling through the strategies and evidence-based interventions just to see what sticks out and what sounds good. And then going to the bottom here on the learning community, this is where I mentioned before that we'll be housing all of our documents, anything that is tied to our learning sessions, you will find at this page here. We will have, again, the recordings available. We'll have any presentations, any resources, any tools that we mentioned during the learning community sessions, we will house in this area here. It'll also contain the times and dates for these sessions. So if ever you're not sure when the next session will be or what the topic of the next session will be, feel free to consult this learning community tab. Next slide, please. So I know I am going through really quickly. I want to take a quick pause before moving on to see what questions folks have. And we will, just to let folks know, we will be providing, we're recording the call today and we'll be able to provide this recording as well as we will provide the slide deck as a resource for you when you're getting signed up and getting started. So feel free to come off mute if you have any questions. I'm just looking in the chat. I'm not seeing any questions right now. Pause for a minute. A very quiet group today. Oh, thank you, Sonia. Sonia gave us the name of the group who was singing our song this morning. Thank you. Any other website questions, y'all? I realize it's a ton of information. We're happy to provide any support as you get started. And again, we will be setting up team leaders in the website after this call today. So team leaders, no worries. So team leaders, please feel free, please look, keep your eye out for an email from us that will be adding you to the website. And then if you need any assistance in adding your teammates to the site, let us know. We're happy to hop on a Zoom call or converse by email if you have any questions. Okay. Let's move on. If you think of any questions, feel free to drop them in the chat. Next slide, please. So talking about what our next steps are and reminders for the future. Next slide, please. So like I mentioned previously, we're going to be providing monthly technical assistance for folks. Again, this is optional, but it's available to all of our CHC partners for answering any questions that you may have, anything that pops up. We're happy to hold some space with you for. We're going to offer it at the same time, the first Thursday of every month. From 8:30 to 10:10. We'll have 20-minute time slots for folks. We can use the whole 20 minutes. If you just have like a quick question and want to do a little 5-minute session, that's fine too. We really just envision using this time to help folks with any issues that they might be experiencing. Sonia will be following up with a sign-up link after the call. Our first TA availability will be the Thursday coming up, so September 1st. If these, and again, if these times don't work, let us know. We can definitely schedule outside of this time frame, but we wanted to just make sure that we had a monthly reoccurring availability for folks to sign up.
Lindsay, I just wanted to chime in that we've had quite a few sites take us up on this offer to provide individual technical assistance, especially when it comes to support for how to improve response rates to the PCCC, other questions, and it's been really, really useful. And I think we've come up with some great ideas for improving things. So I highly recommend, if you're having any issues with data collection, questions about your data results when you get them, questions about your, which way, like if you want specific input on your quality improvement or the learning collaboratives, please schedule something and we can find a time to talk.
Absolutely. Thank you, Becky. Yeah, our conversations on PCCC have been really fruitful so far. So definitely would encourage folks to sign up as soon as you can. Next slide, please. So for our next steps leading up to our session in September, we ask that folks form their team. So identifying which team members from your site will be participating. And that can mean in a variety of different ways. So they're attending the learning sessions, they'll be participating in TA. Just let us know who these folks are. You can email us their names, their names in email addresses, and as well as adding them to the website. As I mentioned before, please create your accounts. Once we get you up and running, add your teammates, team leaders. That would be great. And if you need any assistance, let us know. I'm happy to help out. And then start your clinic assessment. So once folks are in the website, feel free to start looking through the clinic assessment. Again, on the located in the assessment tab on the website. Should take about 15 minutes to complete. It's not super long, but we do want to let folks know that team members can take it separately because there is that option to have sort of the average show. So feel free to take it separately. You can take it with another team member, but start looking around at the assessment as well. I would say the assessment works best after we have PCCC data in. So next slide, please, Sonia. So if you could finish collecting your 50 PCCC surveys, that would be great. It would definitely help move the process along. There is an extension available for folks. We've talked with a few organizations who are not going to be able to meet the August 30th deadline, which is understandable. So we are offering a extension until September 14th if needed. That being said, there are a ton of benefits of getting your surveys in by August 30th, including being able to submit your invoices earlier. But again, if you do need an extension, no worries. Please just let us know that you need the extension and we'll be happy to get in touch. No worries about that. Please complete your organizational assessment. We've sent out a couple more reminders on those. If there are any last minute staff surveys, I know the date has passed on those, but if there are any stragglers, please do let them in and get those in ASAP. And for our HCCN partners on the call, who I see a couple today, please get that sync-based ECQM pilot and baseline data extract put together. I want to give a huge shout out to Ochin, who I see is on the line. They have gotten their baseline data extract in. Thank you, Ochin. So please do reach out to Far Harbor or UCSF folks if you need any assistance on getting that put together. And also submitting invoices. So deliverables 1, 2, and if you've finished the remainder of deliverable 3, please do submit those. Becky had sent out an updated invoice template. So feel free to use that updated template. It's a little more streamlined and easy to use. And let us know if you have any questions on invoice submission. As always, feel free to reach out to us for any support. Like I mentioned, we can hop on for TA, we can talk about invoices, whatever you need. Our emails will be listed at the end of this slide deck. Next slide, please. And any questions for folks? I saw a couple come through on the chat. Yes, Leanne, we'll be able to email the slides after the meeting today, no problem. I definitely envision this slide deck as being sort of a resource for folks as they get started up on the website. So hence why we included all those screenshots in there, but feel free to reach out. Any other questions from folks?
I think Leanne had a question to the other CHCs wondering if other teams are having non-clinical support staff on their learning community teams, or plan on inviting them to the specific learning communities.
Do CHCs have non-clinical support staff coming? Feel free to either come off mute or write in the chat.
Or if you're not sure, say you're not sure.
By non-clinical support staff, you mean maybe like our registration clerks?
Good question. I was thinking more are, at least at my clinic, the medical assistants, or we have like a couple of medical assistants that do just women's health or do women's health support. So coordination around usually around pregnancy, but also around women's health, and then a health educator that does a lot of contraceptive counseling and other sort of breastfeeding support. So bringing in those folks that are already involved in this kind of work.
I am planning on including the medical assistants and also one of the social workers she mostly participates in centering, but I think it is important because during the time that she's educating the patients about either breastfeeding or the postpartum period, I think it is important for them to be educated about, their contraceptive options as well.
Okay. Thanks, Larissa. I'd be curious to hear how, I'm going to ask around after this meeting and see if I can get folks on board, and I'm expecting maybe some hiccups. And so like logistical around bringing those folks in and how they're paid and how they get time out of their other jobs and all of those things. So that's why I'm asking. So any support would be welcome.
For sure. And there may be like learning sessions that are more tailored to, or might be just like a better fit for their job description. So we can definitely give you descriptions of what sessions will be so that you can make that decision on who all will come. That's a great question. Any other questions from folks? Any other, whether it's on QI or navigating projects? Let's see. Okay. Well, defying my predictions, we ended 9 minutes early today. So I appreciate you all joining so much. If you do have any questions, please feel free to reach out. Again, Sonia, can you just pop up the slides that has the last slide with our emails in it, so that folks can have those up. But if there are, again, any other questions, please feel free to reach out. We'll look forward to seeing you in September at our first learning session. And we'll be in touch that should say September 16th, not September 19th. I apologize. I'm going to write it in the chat as well. We'll look forward to seeing everyone then. And you have our email addresses if you need anything. And like we had mentioned before, I'll also send out the slide deck as a resource just to have on hand. But otherwise, please enjoy the rest of your day. Take care, and we'll talk soon.
Thanks, everybody.
Bye, everyone.
Thank you so much. Looking forward to our work together. Hi.
Great job, Lindsay.
Yep, great job.
Let me stop the recording.
I'm so sweaty.